I come to the floor to speak about the recently released Republican health care repeal bill and to speak on the nomination of Seema Verma to serve as administrator for the Centers for Medicare and Medicaid Services. CMS is an agency touching the lives of 125 million people. 34% of Americans receive their health insurance under one of the 3 federal programs run by that agency: Medicare, Medicaid, and the Children's Health Insurance Program. These programs are vital to the health and well-being of seniors, children with persons with disabilities, and low-income families. And yet their vows to repeal the Affordable Care Act, with those vows, President Trump, Health and Human Services Secretary Tom Price, and congressional Republicans are sadly attempting to gut the Medicaid program and to jeopardize the future of Medicare. The head of CMS should be someone who believes in these core programs and is willing to fight to preserve them. Instead, Ms. Seema Verma's record, as well as comments she's made during her confirmation hearing, indicates she's more than willing to take dramatic steps that could force people to lose their health insurance or dramatically increase out-of-pocket costs. From her refusal to disavow efforts to repeal the Affordable Care Act to her willingness to cut the Medicaid program, I do not believe Ms. Verma is the right person for this job. When it comes to the Affordable Care Act, constituents, Republicans, Democrats, independents are angry and frightened about what the Trump administration and congressional Republicans might do to health care. And based on what has finally been released, they have good reason. In over 2 months, Republican leaders in Washington have taken numerous steps to change and even sabotage our health care system, jeopardizing patient access to care and throwing the system into chaos. Before President Trump took office, congressional Republicans rammed through a budget bill, laying the groundwork for the quick, silent repeal of affordable care, despite the fact they had no replacement. Then on its first day in office, the president signed an executive order to weaken the Affordable Care Act, instructing federal agencies to stop doing their job under the law. The president then acted hastily to stop federal outreach efforts, TV ads, radio spots, and emails intended to encourage more Americans to sign up for health insurance. I watched yesterday as the Speaker of the House, Paul Ryan, said that the Affordable Care Act is collapsing. Well, I can tell you, it needs help. It should be bipartisan. And instead, the Republicans are doing everything they can to jeopardize it. Last week, the president met with the big insurance companies to discuss what they want for health care. Where were the patients, the hospitals, the doctors, the nurses, the community health centers in these conversations? It's clear that congressional Republicans want to move full steam ahead on repealing our health care law. The problem has always been, and still is, they can't agree on how to move forward. They don't have a plan to protect people. Some Republicans just want to repeal. Others want to repair. Others want to rebuild. They can throw out all the R words that they can find in the dictionary, but at the end of the day, they don't know what they want to do. These disagreements have become even more obvious in the last week. For the past few months, House Republican leaders have been meeting secretly to craft a repeal bill. Well, they finally unveiled it. No wonder they wanted to keep it secret. Incidentally, this bill, which has been authored by the Republicans, a party which claims a commitment to fiscal soundness, has not been scored by the Congressional Budget Office. We don't know, even as it's being considered by committees in the House of Representatives, whether it's going to add to the deficit or not. You would think that the party of fiscal integrity, the Republican Party, would ask that question early on. As yet, they have no answer, and yet they're proceeding full steam ahead. The bill first would end Medicaid as we know it, cutting $560 billion from the program and limiting care. Who are the beneficiaries of Medicaid? The largest group of beneficiaries are kids and mothers. The second most expensive group are seniors, many of them in nursing homes, who without Medicaid and Medicare could not even continue in a good nursing home environment. Keep in mind that 1 in 5 Americans currently depend on Medicaid for their health insurance. 65 million people nationwide. That includes 35 million children, 7 million seniors, 11 million people with disabilities. We used to say, well, Medicaid, that's for poor people. Well, it certainly is for lower-income Americans, but many of them are working low-income Americans who still qualify for Medicaid. My friend, who has worked in the motel, hospitality industry all of her life, in her 60s, sadly is a part-time employee. Despite her hard work, she can't afford health insurance, but she qualifies for Medicaid. She is part of the working poor, and she is one who needs this benefit. And if the Republicans have their way and reduce Medicaid coverage, she could certainly lose it. In my home state of Illinois, 650,000 people have gained health care coverage under Medicaid thanks to the Affordable Care Act. For her and others I've met, it is the first time in their life that these men and women, often in their 60s, the first time in their life, have health insurance. Of Illinois' 18 congressional districts, not a single one has less than 71,000 Medicaid enrollees. 1.5 million children, nearly half of all the kids in Illinois, get their health care through Medicaid. And the Republican repeal bill is going to endanger that. That is so obvious that yesterday, the Republican governor of Illinois, who is careful in his words and seldom reacts, came out publicly and said that the Republican repeal bill would significantly hurt our state of Illinois. That from a Republican governor. Medicaid is the largest payer of long-term care for seniors in the nation and in Illinois. It is one of our best tools, incidentally, for addressing the opioid epidemic, ensuring that those facing addiction have access to treatment. And the Republicans want to cut that. Medicaid has been a lifesaver to Illinois hospitals, especially in my part of the state and downstate Illinois. Repeal of the Medicaid expansion, as the House bill proposes, could result in the loss of up to 90,000 jobs in Illinois. The Republican repeal bill on health care is a job killer in Illinois and across this nation. We will see hospitals cutting back on personnel in an attempt to adjust to the cutbacks in coverage and the increases in cost brought on by the Republican repeal bill. But the bill goes further. It dramatically restructures the entire Medicaid program. When talking about the plan for Medicaid, congressional Republicans throw around innocuous terms: per capita caps, block grants, more flexibility, modernizing. Don't be lulled into a false sense of security by these words. This Republican health care repeal bill would significantly cut back on federal spending on Medicaid, shifting the cost to states, families, and individuals who are currently struggling to get by today. With less funding, states could be forced to throw people off of Medicaid, limit the types of health care services offered, create waiting lists, and much more. In the name of state flexibility and modernizing, it means that more and more people will be showing up at emergency rooms in Illinois and across the nation with no health insurance coverage under the Republican approach. Oh, they'll get care, and it'll cost. They can't pay for it, and that cost will be shifted to others with health insurance. Unfortunately, Ms. Verma has significant experience in this exact type of health care rationing. In her role as a private health care consultant, she championed radical Medicaid overhauls. She supports making low-income Medicaid beneficiaries pay more money. She believes that Medicaid beneficiaries need, quote, more skin in the game. I wonder how many Medicaid recipients Ms. Verma has actually sat down and met with. The Illinois folks I know, or the mom working 2 jobs struggling to take time off from work to take her kid to the doctor, or the senior who has literally spent down all of her life savings on nursing home care and has no place else to turn. Devising plans that restrict access to care for the most vulnerable among us are not the qualifications I'm looking for in a person who wants to run the agency responsible for Medicare, Medicaid, and CHIP. And finally, on the House Republican repeal bill. In addition to gutting Medicaid, the bill eliminates the Prevention and Public Health Trust Fund, which currently provides the Center for Disease Control and Prevention $900 million, 12% of their budget. The bill defunds Planned Parenthood. The bill allows insurers to charge older people significantly more in premiums than allowed under current law. The bill, incidentally, dramatically cuts taxes for the wealthiest people in America and increases costs for middle-income families. Most telling, as I mentioned earlier, the House Republicans won't even send this bill or wait for a report from the Congressional Budget Office before proceeding. How many people will lose their health insurance under the Republican repeal plan? How will out-of-pocket expenses go up for families under the Republican repeal plan? How much responsibility and burden will be shifted to the states under the Republican repeal plan? For now, Republicans can claim ignorance because they decided to move forward before there was a report from the Congressional Budget Office. Thank goodness some Republicans are speaking out against this terrible plan. Maybe not for the same reasons I oppose it, but conservatives say it doesn't rip health insurance away from more people more quickly. And moderates worry about Medicaid, demonstrating again the lack of a consensus on the Republican side when it comes to the future of health care. We have big challenges ahead, challenges which will determine whether we have as many people in America with health insurance tomorrow as we have today, and how much it'll cost. I don't believe the Republican repeal bill is the right path forward, and I don't believe Seema Verma is the right person to stand up and fight for nation's seniors, children, and low-income families. For that reason, I'll be voting against her nomination to serve as administrator for the Centers for Medicare and Medicaid Services. Mr. President, I yield the floor.